Hi everyone, in this video I wanted to do an introduction to the human body. So to start out, I want to look at the anatomical position, which is going to be this reference position in which we are going to refer to all patients and the human body as we're learning it. So anatomical position is pretty easy. In fact, the patient is just standing straight forward, or the body that we're referencing to is facing forward with palms facing towards the anterior or towards the forward. And it looks much like this picture. Now, this is important because when we reference back to the human body, we need this starting reference point. Because the body can be manipulated or we can orient in different ways, having the starting position is important so that we can always be referencing to the correct location. This will make a little bit more sense when we start talking about directional terms. So remember, anatomical position, the face facing forward or pointing forward in a neutral position. The feet are in a neutral position facing forward, so toes forward, nose forward, and our palms are facing forward down at our side. So kind of like my skeleton here, standing sort of erect with his palms facing forward. Now, let's get into anatomical terms or directional terms. So directional terms are going to be important for us because directional terms are going to give us a reference point. And often when we're talking about directional terms, we are referencing from one position of the body to another. So, for example, we have the head, and towards the head is going to be the cranial region. It is also referred to as superior. Now, cranial specifically towards the head region, superior is just going to be above another reference point. Opposite of the cranial, we have caudal, and that is away from the head, and that's towards the tailbone region. So cranial and caudal. I also mentioned superior. Superior is above, inferior is going to be below. Now we have right and left, right? We also are going to have anterior and posterior. Anterior is towards the front of the body. Posterior is going to be towards the back of the body. Anterior also sometimes uses the word ventral, and posterior often uses the word dorsal. Think dorsal fin on a dolphin, right? On the back of the dolphin. Some other words that we have are going to be used in reference to one another. So 2 points in reference to each other. So that is going to be proximal and distal. Now, proximal and distal we typically use for the appendages, so the arms or the legs. And something is proximal if it is closer to the origin or the insertion point. So let's say toward where the arm attaches to the axial body. So proximal. Distal is further away from that. So we use 2 points when we're talking or using these terms. So let's use the elbow to the shoulder. The elbow is going to be distal to the shoulder. The shoulder is proximal to the elbow. If we did the elbow and wrist, for example, the wrist would be distal to the elbow would be proximal to the wrist. So closer to the site of origin or the attachment point. Some other things that we have are medial and lateral. Medial is towards the midline of the body, where lateral is towards the outside. So if we're using 2 reference points, we can use, for example, we can use the kidney is lateral to the spine. The spine is medial to the kidney towards the midline. So medial and lateral. Another directional term that we often use is superficial and deep. If we're talking about something being superficial, you may have used this term yourself in that something was a superficial cut. In your brain, you're probably thinking that it's not very deep. Deep means the opposite, which is deep or further down. Superficial and deep is also used, it can be used as just a singular term, as in it was a superficial wound, but we often use it with 2 reference points, much like we have done with these other directional terms. So for example, the skin is superficial to the muscles, or the kidneys or the liver are going to be deep to the skin. So superficial and deep is another directional term. Now, the next thing I want to talk about is the different planes of the body. So the planes are most commonly used in the body for things like medical imaging, and there are 3 of them that are the most common. So the 3 of them that are most common, we have the sagittal, frontal, or sometimes called coronal plane, and the transverse plane. So when we look at the sagittal plane is going to divide the body into right and left. Now, if it is directly in the middle of body and dividing into equal portions, we would call this the mid-sagittal plane. I like to think of the planes as sheets of glass. So if you're dividing the body into right and left halves, we have a sheet of glass going up and down the middle of my body. And so this would be that sagittal plane, dividing me into a right and left half. Now, the other one is going to be a frontal plane, or sometimes called the coronal plane. The frontal plane faces the front. So think of a piece of glass dividing me this way into an anterior and posterior portion. So frontal or coronal plane. We also have the transverse plane, and the transverse plane, or sometimes called the horizontal plane, goes with the horizon. That means we're going to divide the body into a superior and inferior portion, and the transverse plane can be anywhere along the body. Now, we see this a lot in different medical imaging. So if we think of the views of CT scans or MRIs, or looking at things like x-rays, all of them are in different planes of the body, or looking at the body from different vantage points. Sometimes we're dividing the body into small little plates or cross sections, and that means we're going across the transverse plane. So these planes also can be used to track the movement of the body within these planes. We'll get to that a little bit later, but if you think about them as windshields, for the frontal plane, for example, frontal or coronal plane, the one that divides the body into an anterior and posterior portion. If we think about movement along it, think about windshield wipers moving along this imaginary plane that's cutting me into a front and back half. That would be movement along that frontal plane. So we'll get into movement later, but those are the planes of the body. Next thing I want to talk about is the way that we could divide up the abdominal region of the body. So the abdominal divisions of the body, we could divide this up into either regions or into quadrants. The region system is looking at 9 different regions, and they all center around an umbilical region. Let me put this picture up here. So we see the umbilical region in the middle. Above that, we have the epigastric. Below it, the hypogastric. To the right and left of the umbilical region, we have the left lumbar region and the right lumbar region. If we look above those, we have the right hypochondriac and left hypochondriac. And if we look below them, we have the right iliac and the left iliac region. Now, these regions are important because it is a way for us to signify where pain may be coming from or what is going on underneath the skin. Remember, when we look at a patient, not always will we know what specifically is wrong with them, but they're going to point to something on the outside of their body. Dividing the body up into these regions allows us to sort of consolidate what we could be talking about. And you'll notice in the overlap of this picture, you could see the different organs that lie underneath each piece. Now, that does give us a little bit of an idea of where something may be going wrong or where a patient may have pain. Outside of the regions, the 9 regions that we have, we can divide it into quadrants. And the quadrants are the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. And so these are all the ways that we can divide up the human body. The next topic I want to talk about is the body cavities. So here we can see the layout of the body cavities. The first thing we'll start with is the 2 main divisions that we have, and that is that we have a dorsal towards the back body cavity and a ventral body cavity, which is towards the front. When we look at the dorsal body cavity, it's going to have 2 pieces or 2 components to that, and that is going to be the cranial and the vertebral body cavity. The cranial cavity is going to have the brain inside of it, and the vertebral is going to sit inside of the vertebrae and have the spinal cord in it. When we look at the ventral body cavity, this is everything on the anterior part of the body, and this is going to be divided up into these different colored blocks that we have here, which are the individual cavities inside. So the ventral body cavity is going to have the thoracic body cavity here, which is going to have these components, the superior mediastinum, the pericardial cavity, and the pleural cavity. The pericardial cavity, which encloses the heart, and the pleural cavities, which is going to have the lungs in them. and this is inside the thoracic cavity. We also have the abdominal pelvic cavity. The abdominal pelvic cavity is going to have the abdominal cavity and the pelvic cavity in it. And these cavities are just what's going to encompass the overall organs that sit inside of those regions. For the next part of this lesson, I wanted to talk about the regional terms of the body. Now, I understand that this is a lot to memorize and seems a little bit overwhelming. However, if you put in the work now, I promise later, when you're trying to memorize all of the muscles, the bones, looking at arteries or veins, all of these are going to be very useful because a lot of them are going to be named from the regions that they are associated with. So let me share my screen. So here we can see the different regions of the human body. Again, I know it looks overwhelming, but you can do this. In fact, you may know more than you think that you do. So we have two pictures. We have an anterior view and a posterior view of a model looking or of a model in anatomical position. That means face facing straight forward, palms facing towards the anterior, and toes in a neutral position facing forward. So this is anatomical position, and this is an anterior view, and this is a posterior view. In the head region on the anterior view, we have a few terms up here. So first we have the frontal or forehead, sometimes called the frons. The cranium is the skull or the cranium in general. The facies or facial region. We have the oris or otic region or auricle region, which is the ear. We have the nose or nasal region. The oris is often referred to as the mouth or the oral area. Moving down to the chin, we have the mentalis or mental region or chin region. And then below that, the cervicus or the cervical region or the neck. Moving down, we have going down the arm, we have the axillary region, which is the armpit region. We have the brachium or the brachial region, which is the front of the arm, the bicep area. We have the antecubital region or antecubitus, and this is the front of the elbow, going to be an important part or an important location. Antecubital region is a common spot for putting in an IV or drawing blood. The antebrachium is going to be on the front of the forearm or the anterior part of forearm. Remember, anatomical position is important here. The pollicis or pollux is the thumb. The carpus or the carpal region is the wrist. The carpal bones right here. The palmar or palmar region, and then the digits and phalanges. If we go up underneath the neck, we have the thoracic region or the thorax, and this is going to be the chest area, the mammary or breast region, the abdomen or the abdominal, and the umbilicus or navel region is the region of the umbilical cord insertion. And then we have the pelvic region. All of these are going to be part of the trunk. Going down the leg, we have the, below the pelvis, we have the inguinal region. We have the femur or the thigh femoral region, the patella, which is the kneecap region, sometimes called the patellar region. Below that is the crural or crus, this is the lower leg. The tarsus or the ankle, this is where the tarsal bones are. The digits and phalanges, we also call the toes. So the fingers and the toes are the digits or phalanges. We have the hallux, which is the greater toe. I think I might have missed the pollex, coming to think of that, of the thumb. So pollex or pollicis is the thumb region, and hallux or hallucis or great toe. The pedis or pedal is the foot, or sometimes called the pes. You'll see the pes up here. On the posterior side, some things that we have the cephalic region is the head. We have the cervicus or cervical region. Talked about that already. The shoulder is sometimes called the acromial region. The dorsum or dorsal region is the back. The brachium is the back of the arm. The olecranon is the back of the elbow. We'll see things like the olecranon process or the olecranon fossa here in the bones of the back of the elbow. We have the antebrachium, which is the back of the forearm, And then, of course, the manus or the hand. We have the gluteal region or gluteus, or sometimes buttock, or all the regions for the butt. The femur, the thigh or femoral region. The popliteus is the back of the knee, sometimes called the popliteal region. We'll see things like the popliteus muscle sitting here. The sura or sural region is the calf. Calcaneus is the heel, and the plantar or the sole of the foot. I always think of this like the plants plant in the ground, and so that is the sole of the foot because that walks on the ground. So hopefully that helps walking you through all of these words. Again, important to memorize these. So spend a little bit of time doing this and it will make your life easier as we move on. If you need anything, make sure you reach out to me. I'm here to help. As always, happy studying.